Your kidneys are quiet guardians, working every second to filter your blood, balance your fluids, and keep your body in harmony. But in chronic kidney disease, or CKD, that delicate system begins to decline. CKD is a progressive, irreversible loss of kidney function that lasts 3 months or longer. It's classified in stages. In stages 1 and 2, damage may be mild and silent. Stages 3 and 4 bring fatigue, weakness, and reduced endurance. And stage 5, known as end-stage renal disease, often requires dialysis or a kidney transplant. Most cases of CKD begin with familiar conditions, diabetes, high blood pressure, cardiovascular disease, or long-term medication use. Imagine a 58-year-old with years of uncontrolled hypertension who suddenly notices declining energy. That's often how CKD reveals itself, slowly, quietly, and progressively. But CKD doesn't just affect the kidneys. It impacts the heart, increasing the risk of atherosclerosis and thickening of the heart muscle. It affects the muscles, causing wasting, weakness, and bone loss. It affects metabolism, reducing red blood cell production, disrupting glucose control, and lowering aerobic capacity, what we call VO2 max. That's why exercise becomes essential, but it must be done safely. Submaximal testing is preferred, and heart rate and blood pressure must be monitored closely, especially for dialysis patients who should exercise on non-dialysis days when possible. So what does the ideal program look like? Aerobic exercise, like walking, cycling, or swimming, 3 to 5 days a week at a gentle, moderate pace. Resistance training, 2 to 3 days per week, using light to moderate loads, avoiding breath holding. And flexibility work, daily stretching to maintain mobility and reduce stiffness. Even something as simple as seated cycling or resistance band exercises during dialysis can improve strength, endurance, and overall quality of life. Kidney transplant recipients can return to exercise too, but slowly, carefully, and with attention to infection risk and bone health due to lifelong immunosuppressant medications. The message is simple. CKD may be chronic, but movement is powerful. With the right guidance, exercise helps restore strength, protect the heart, improve energy, and give patients control over their health. One step, one breath, and one session at a time.